Hi, I'm Dr. Radhika Kopikar, the Chief Dermatologist and founder of Kopikar Dermatology Skin Hair Laser Clinic in Vikhroli East, Mumbai. And today we are going to talk about hair fall and its treatments. So there are various kinds of hair fall. The most common ones that we notice in our practices is male and female pattern alopecia. In male pattern alopecia or male pattern baldness, what we see is the hairline starts receding from the temporal parts or the frontal area, and it goes on progressing with time, and then they start balding or losing hair from the center of the head. In females, what we see is thinning in the center of the head. It's called female pattern alopecia or female pattern baldness. The other kind is telogen effluvium, where a lot of hair, chunks of hair starts falling off due to a sudden shock or an illness which happens in the body. And here the hair which are in the anagen phase suddenly start shifting into telogen, which is the resting phase, and then start falling in chunks. So we often get patients coming to us with bags of hair fall to show us exactly how many hair they are losing per day. We often say that about 100 hair shedding every day is considered normal, but it's much more than that when somebody is facing telogen effluvium. And I would suggest don't waste time in changing shampoos, oils, or some home remedies, thinking that that would help, because this normally happens due to a sudden stressful factor that comes into your life, maybe a crash dieting or a sudden illness or a bout of fever. Or even after pregnancy, what the kind of hair fall that happens is known as telogen effluvium. The third kind is called alopecia areata, where small areas of hair loss is visible on this head, and this is normally picked up by your barber or someone else who is taming your hair, and they point out that there is a loss of hair or there's a patch of hair loss on your head. This normally happens because the immune system starts attacking the hair follicles, extreme amounts of psychological stress, physical stress, or a poor lifestyle. The fourth kind is traction alopecia, in which traction meaning pull. So it's commonly seen in patients who are into heat styling or different kinds of tight hairstyles, and even small kids where mothers would very tightly braid their hair before going to school. So we often tell even mothers to not tie the hair so tightly, leave it a little loose. Clips are always better than very tight ponytails. So the other one is anagen effluvium, where hair shedding happens in the growth phase of the hair itself, mostly seen in patients who are on chemotherapy. The next one is scarring alopecias, where hair fall happens followed with scarring in those areas, and this normally happens due to inflammation, infection, or even injuries for that matter. So this is a condition where you need quick help, because if not, then hair growth in those areas will be compromised, and it will be difficult to grow hair in areas where scarring has set in. We see how people are so busy, they skip their meals, they don't have access to nutritious food. Also, some people are into crash dieting, and all of these reasons can lead to loss or a deficiency of micronutrients in your body, such as proteins, iron, zinc, B12, vitamin D. All of these are so important for a healthy head of hair. Hormonal fluctuations are also a major cause for hair loss. We know that PCOD is a very common problem nowadays, mostly due to lifestyle disorders. Also, patients after pregnancy lose hair. Patients who are entering menopause also tend to thin their hair and lose out and shed a lot of hair during periods when the hormones fluctuate or change suddenly. So PRP is an abbreviation for platelet-rich plasma, where we inject platelets into your scalp. So basically we take some amount of your blood, about 10 ml of the patient's blood, centrifuge and prepare growth factors and PRP out of it, which is then injected back into the patient's scalp. This is a part of regenerative medicine, where we can use the power and the healing mechanism which is in your body to give growth to your own cells. So it's a very novel mechanism of giving life and regeneration to your own cells using your own blood. So it is autologous, very effective, and gives great results in patients who are facing some kinds of hair fall which are responsive to PRP. That is such a funny question. PRP करवाऊं या hair fall treatment लूं? It's never up to you to jump into the solution of your medical problem, right? PRP is a solution for people who are facing hair fall, hair thinning in certain conditions or certain kinds of alopecias. It's not a treatment for everyone. So when you go to a dermatologist, it's not that they will jump into doing PRP for you. They will first examine you, assess the problem, diagnose it, and then go into treatment. And always the mainstay of treatment is your nutritional supplements, applications, the hair growth serums. Those are the mainstay of treatment. Only after a while of doing this will your dermatologist offer you or think about doing certain invasive procedures like PRP or GFC or PRF, depending on what's best in your case. Men are more predisposed to hair thinning and baldness because of genetic factors, and also because they are more sensitive to DHT, that is dihydrotestosterone, which is the main hormone which causes the hair follicles to shrink and stop producing hair. Whereas females have different hormone profiles, they are not as sensitive to DHT, and therefore they are more prone for hair thinning rather than completely going bald. So hair aging is a very natural process of changes in the hair that happens as we grow older. Your hair tends to become more dry, frizzy, thin, and also lose its color. So the best way to prevent hair aging or slow it down is to have a very healthy, balanced diet, have enough water and stay hydrated, avoid too much of exposure to heat styling and chemical treatments, use gentler and good quality products for your hair. Also, something that we often neglect is the premature hair aging that happens due to sun damage. So try and cover your scalp and head with a cap or a scarf when you're outdoors as often as possible. Also, smoking also is a very important reason for hastening the process of hair aging. Regular scalp massages can also help slow down the process of hair aging. For hair fall, after we assess the condition, there are various treatment options which we offer in the clinic. Something as basic as a microneedling treatment or PRP, PRF, growth factor concentrate therapy, low-level laser light therapy, also hair transplant in very advanced cases of hair fall can be offered to you in clinic. All of these are extremely safe treatment options provided you go to the right practitioner. There are so many gimmicks in the hair fall industry because it's a very common problem. So you can understand that everybody is looking for a solution and everybody is offering a solution to you. Let me enumerate some of the very common ones for you. Something which we often read, hair oil for hair growth. That's such a big gimmick. Then we have shampoos promising us lengthening of hair, serums promising us hair growth in a matter of weeks, people offering you hair spas for hair fall treatment, keratin treatment for hair strength, changing your hair texture from curly to straight, and increasing the length of your hair growth using a hair care product. All of these are extremely tall claims. They are fake claims and please don't fall for them. Thank you for watching Dermis with Dermats. We'll be back with another interesting video on skincare and hair care very soon. If you have any questions regarding hair fall and its treatments, please drop it in the comment section below.